Hello, dear listeners, and welcome to the very first episode of the 10 Minute Social Work Podcast. I am your host, Masa Kaviampur. In this episode, we are going to talk about, yes, you're right, dementia. But before we get started, we as social workers know perfectly that every chronic disease is multidimensional and has physical, psychological, social, and economical impacts on people's lives. And explaining all of these aspects in one episode is not really practical and possible, as every episode of this podcast will be 10 minutes. So I dedicate this episode to the biological aspect of dementia. In upcoming episodes, I will explain the other aspects of dementia as well. But first of all, why is it important and crucial for social workers to learn about dementia as a chronic disease? And the answer of this question will be in fast and speedy aging population around the world. Based on global statistics, by 2030, 1 in 6 people in the world will be aged 60 years and older, and by 2050, the world's population of people aged 60 years and older will be doubled, will be around 2 billion people, which is a very significant and substantial number of people. We social workers, we are change makers in every community we are working in. To do a better job, to have a more effective practice, we should gain more knowledge and have sufficient knowledge about any topic and in chronic diseases in older adults and do research and base our practice on those research and in other words we should have evidence-based practice to have a better and effective impact on our uh, target groups, which is here is older adults. One of those aging specific chronic diseases which is very, very important is dementia. There are a number of definitions for dementia, but WHO defines dementia as a term for several diseases that affect memory, thinking, and the ability to perform daily activities. There are some keywords which are really important for in this definition. One is dementia is a term for several diseases. So we can say, based on this definition, dementia is not just a one disease, it's a term for several diseases. That all of those diseases affect memory, thinking, and the ability to perform daily activities in a negative way. Dementia is a progressive illness and it gets worse over time. Unfortunately, it mainly affects older adults, older people, but not all the older adults will get it as they age. Dementia destroys nerve cells over time, not suddenly, and damages the brain as a result, and typically leading to deterioration in cognitive function beyond what might be expected from the usual consequences of biological aging. In dementia, usually consciousness is not affected, but the impairment in cognitive function is commonly accompanied and occasionally preceded by changes in mood, emotional control, behavior, or motivation. Dementia has physical, psychological, social, economical impacts not only for the people who are living with dementia, but also for their loved ones, for their caregivers, families, and society at large. In dementia, like other chronic diseases, Uh, there are often a lack of awareness and understanding of dementia, which resulting in stigmatization and barriers to diagnosis and care. And I think we as social workers, we often encountered these stigmatizations and lack of awareness in our daily practice, which is really important for us as social workers to gain knowledge ourselves and spread that knowledge as a form of awareness to our community and society. In terms of dementia statistics, what stands out is that currently more than 55 million people have dementia worldwide. Over 60% of these people living in low or middle income countries. And surprisingly, every year there are nearly 10 million new cases of dementia, which is really, really surprising. Every year we have more than 10 million new cases. It shows the significance of dementia and the dementia care. And also, dementia is currently the seventh leading cause of death and one of the major causes of disability and dependency among older adults globally, which highlights the importance of addressing this disease as social workers. If you remember, I told you based on the definition of dementia is a term for several diseases. So it is indicating that dementia has some kind of types and diverse forms. So let's move on to types of dementia. As you can see in this slide, we have six types of dementia, and the first one is Alzheimer disease, which is caused by abnormal deposit of proteins, which forms amyloid plaques throughout the brains. And the Alzheimer's usually has three stages: mild, moderate, and severe, and which is kind of apparent that in mild stage we have symptoms such as getting lost, repeating questions. In case of moderate stage, the symptoms intensifies in forms of problems such as problems recognizing friends and family members and impulsive behaviors, and in the last stage, which is severe stage, the patients cannot communicate, unfortunately. The second type, frontotemporal dementia, is again caused by abnormal amounts of proteins, some kind of proteins called TDP43 or 447. Um, TDP43 proteins inside neurons in frontal and temporal lobes. The symptoms are diverse based on what kind of frontotemporal disorder a patient has, but they can be ordered in three areas: behavioral and emotional symptoms, such as difficulty in planning, emotional flatness, excessive emotion, or impulsive behaviors, movement problems, such as shaky hands, problems with balance and walking, language problems, including difficulty making understanding speech. These are the symptoms of frontotemporal dementia. Uh, the next one, Lewy body dementia, is also derived from abnormal deposit of another protein called alpha synuclein or Lewy body, which affects brains of chemical messengers. In this type of dementia, the patient will be experiencing cognitive decline, movement problems, sleep disorders, and visual hallucinations. Turning next to the vascular dementia, which is kind of obvious from its name. In this type of dementia condition, uh, for conditions, for instance, blood clot disrupts blood flow in the brain and making the patients to forget current or past events and misplacing items, troubles in learning new informations, or having an experience in delusions or poor judgment. As you can see, we have two other types of dementia, such as other types, such as Huntington's and mixed dementias. But because the first four types of dementia are the most significant, and people mostly get one of those four. We don't really explain these last two ones because, as you can see, it's mixed dementia, and which is kind of mixed up those four dementias that I mentioned before and explained before. So I don't explain them, but you can search online or read the references that you can see in the description of the podcast or in the references on the YouTube slides to search them and learn more about them. But I focused more on those Alzheimer, frontotemporal, Lewy body, and vascular dementia in this episode.